in pursuit of health and wisdom. Sapio with Buck Joffrey.
Welcome back to Sapio with Buck Joffrey. This is Buck Joffrey, and today my guest is Dr. Romie Mushtaq. And Dr. Romie is a board-certified physician. She's trained in neurology and integrative medicine. She's a founder of Brain Shift at Work. She brings 20 years of authority in the space, and she is on a mission to transform mental health and wellness in the workplace, and currently works with Fortune 500 companies, professional athletes, and global associations. She's the author of The Busy Brain Cure, the 8-week plan to find focus, tame anxiety, and sleep again. Romie, welcome to the program.
Buck, thank you so much for having me. I've been eager to have this conversation with you and your audience.
Good. And I know you're doing something new that I didn't add here because I think maybe my bio wasn't updated, but maybe you could start telling us a little bit about that.
I think it's so exciting the way the world is moving forward. I will start by this telling one doctor to another fellow doctor that it's obvious to anybody that the healthcare system is broken and overburdened.
Right.
I firmly believe that one of the solutions to keep people healthier and alleviate the sick care system is to start inside corporate America. So for the last 6 years, I was serving as Chief Wellness Officer at Evolution Hospitality. And in January of 2024, I took a new position at Great Wolf Resort. So my job as a doctor is to use data-driven solutions to create systems and programs to help the mental, physical, and whole person health of over 12,000 employees at our organization.
Well, fantastic.
Yeah.
You know, with your training in neurology and obviously in allopathic medicine, and let's talk about stress, because at the core of everything, it sounds like you do really, it's about stress, right? So we use that term all the time. And is there a clinical definition of stress?
Yeah. We use the term all the time, and most of the time incorrectly, as you know, and interchange it with burnout. And so when we think of the types of stress of exceeding our resources, first of all, it can be physical stress. Like I think of something simple as I picked up a weight to do bicep curls.
Yep.
I am behind in my strength training in the post-pandemic world, and physical stress was picking up something that exceeded my weight limit to try to do bicep curls this morning. That's a simple way to look at physical stress. We look at emotional and psychological, and then financial or social stress. So that is one psychological definition. In medical terms, and in what I do and you do in the world, we need to look at stress as far as a time continuum. Because the biggest myth I could start out by busting here on this podcast with you is this pre-pandemic notion that was floating out there that stress is good for you. Stress, we have acute stress, which can come on in seconds to minutes and typically is alleviated just as quickly, the situation. Then there's the place that I live and I'm most interested in is chronic stress that has been going on for weeks, months, years. And as it then transitions into what we call acute episodic stress. So you're under chronic stress already, and you have acute stressors on top of it. So an example I give, somebody that's under chronic stress already, they may be having a strain in their marriage or going through a divorce. And then on top of it, they're dealing with repeated stresses at work, a merger and acquisition, budget, deadlines and budget season at work. And that's an acute on chronic stress. And I think it's really important to differentiate those, because living in a world of chronic stress or acute episodic stress, which is I'm chronically stressed and I have acute stressors coming on top of it from other areas in life, can cause physical disease, and it can actually kill you. And that's why I do the work I do. And that's where I think we need to start.
Let's start with that, because I think it's, and I think it's helpful to, as I like to do, is really get into the physiology. And if we could, what's happening when we experience these stressors, right? At the cellular level, what is going on that ultimately potentially creates disease?
Yes. Let's talk about, I think, in a pre-pandemic world, I want to start on a simplistic level. we would say, oh, you're stressed? Eat berries, breathe, write a gratitude journal. And you would hear the acute stress model talked about, and that isn't the whole picture, but I want to go over it now. We talk about the Walter Cannon-Bard theory of acute stress, that an acute stressor happens and emotions are processed in our limbic system. And that it can, in turn, in our limbic system, in our amygdala, as we're processing emotions, raise acute stress hormones, such as cortisol.
Right.
And if we did some deep breathing, you could rewire that through the vagus nerve system. Well, that's not how all stress works. And I think this is where we're missing out. And this is the place I live, and I've been researching, and the research is out there. So what I want us to move forward into why nobody wants to be told to eat berries and breathe anymore. They're coming to you, Buck, and saying, I did the gratitude journal and it didn't work. Like, I tried to meditate. Am I doing something wrong? Well, this is what's happening. In a psychological, when you look at the global psychology data answering this question of why we have a mental health crisis and why people are so unhappy in the post-pandemic world, we're at something known as psychological capacity now. So this isn't just about an acute emotional stressor on the limbic system. This is, I'm at capacity. The emotional bucket is full and overflowing. And so here's where I live. In chronic stress, this is not just about the Walter Cannon-Bard theory anymore. This is, hey, Buck, Romie, the stress never went away in your brain. It's been building. Something else fascinating is happening here. Neuroinflammation from chronic stress.
Yeah.
Alone.
So from a physiology standpoint, if I could interrupt, because I do like to kind of, keep some
going deeper. Yeah.
Physiology involved with this. You've got cortisol levels, and I mean, ultimately, you would say, yeah, that's physiologically, that is the main output. No. Okay. So what is the main output of stress?
So that's the acute stress theory where we're missing the mark. So when we go to chronic stress, what I really wanted to highlight is neuroinflammation. Let's go backtrack. And neuroinflammation is not something new for listeners on this podcast who've not heard of it. Neuroinflammation is a process of a lot of underlying brain diseases that we've known for decades, whether it's Alzheimer's, MS, Parkinson's. But here was something fascinating that we found is chronic stress alone, without a virus in your brain or without the genetics that, predispose someone to Alzheimer's or whatever it may be, a brain tumor, is that you could see these same inflammatory pathways, this elevation of interleukin-1 specifically, and that these paths of neuroinflammation were now beyond just the limbic system, but heading into kind of an area I labeled in layperson's term in the book, the airport traffic control tower of the brain, the hypothalamus. And specifically the SCN nucleus, which drives our circadian rhythm and also then secondary modulation of the autonomic nervous system of the brain and the rest of our body then. And so now this is affected with inflammation, and physiologically there's something bigger going on than just temporary bump in your stress hormone cortisol level. When the hypothalamus now is under inflammation, two pathways are going to become dysregulated, and we'll talk about them physiologically here. The first one is your HPA, hypothalamic pituitary adrenal axis. That's number one. And the second one is then chronic autonomic dysregulation. The autonomic nervous system is getting dysregulated.
Just to summarize where we are, we've got basically stress ultimately triggering, the two pathways that you've talked about. And one ultimately is the cortisol pathway. You've talked about the adrenal glands and that sort of thing. And then the other one essentially is the sympathetic nervous system, the fight or flight nervous system, right? So you've got those.
Fight or flight. It's actually more than fight or flight. When it's the acute limbic system, we can talk about fight or flight that resolves quickly. So the number one, hypothalamic pituitary adrenal system, thyroid is also in there. You will have dysregulation of pituitary hormones, thyroid regulation, and adrenals, and then downregulation for sex hormones in men and women, respectively, testosterone or estrogen, progesterone. So I really want to be clear. It's not just about adrenal gland and cortisol. We're missing the whole picture. The second one, is more than fight or flight alone. When you're talking about chronic, persistent autonomic dysregulation. This is your fight or flight response that kind of never comes back down to normal, I don't call it fight or flight response. Fight or flight response is something acute and it gets resolved. This is chronic sympathetic dysregulation. So we see this is why people will now have a persistent elevated blood sugar, increased heart rate variability, persistent elevated high blood pressure, persistent digestive peristalsis in the GI tract, like issues like that. This is a persistent sympathetic overdrive and a lack of an appropriate parasympathetic response. So, it's the prolonged version of what we hear about in acute stress. And that's where we start seeing inflammation in the brain and all the systems in the body that can lead to chronic disease, like hormone imbalances, autoimmune disease, GI inflammatory disease, et cetera, et cetera. So this is like quick headline news version of the mind-body connection, I would say. Yes.
Yeah. And then a lot of those things on top of that will create sort of a feed-forward cycle as well. I mean, obviously, we talk a lot about sleep, for example, and stress affecting sleep, and then sleep in itself having a tremendous, effect on pretty much everything else, including inflammatory responses. In addition to that, just in there's a bunch of things that are ultimately kind of feeding into this, right? You feel stressed, you don't get sleep, and that makes everything else worse, and you have got inflammation.
So what's different in my book that I write, and you'll read, and readers will read in chapter 5, is my theory is that this disruption of the circadian rhythm is at the root of all of this. And that is it. That is the feed forward mechanism to disrupt all the other areas. And so we call it the brain shift protocol when we're dealing with healing the negative impact of chronic stress and burnout for a reason. The shift is 5 key areas, like you said, a feed forward loop that originate in a disrupted circadian rhythm.
Right.
S is sleep. H is hormonal imbalances, specifically thyroid, and we'll get into that in a second. I is other markers of inflammation that we look at, such as dysregulation of insulin and insulin resistance methylation disorders. F is the food we use to fuel ourselves and why, hunger mechanisms and all of that are disrupted and we stress eat. And T is also the role of technology, how that's feeding into a disruption of circadian rhythm. So technology is like that chicken and egg phenomenon. Which one came first, you don't know, but it's all disrupted. So for me, it's that, yes, sleep is a critical and important and the first step in our protocol, but it's actually an entire disruption of the circadian rhythm from this chronic unchecked stress. So I bring it back to that level.
I guess at the physiologic level, any sense of why the stress is disrupting the circadian rhythm?
Well, so we go back to the path that I just told you is what we found that the researchers were seeing, and I had pulled the article. Sorry, I was on back-to-back calls prior to this.
That's okay. It's a little nitpicky question, but I'm just.
It's but what we found in the research. Was this. The chronic unchecked stress with the neuroinflammation, why the SCN nucleus. Sorry, I had the path in there. I had that study pulled up because I was like, oh, this is good. I'll get back to you and I'll email you it and to put in the show notes the specific study, but I broke it down right there in chapter 5.
Just remember, I'm a guy who's actually looked at the suprachiasmatic nucleus in person. So when we have, that's why I'm being nitpicky.
Right, and I have in scans as well. But when you look at that physiological data, so it is. So it's not sleep that's the root cause. The sleep is the byproduct of a disruption of the circadian rhythm. It is an interesting mechanism.
Right.
Here.
Yeah, and we know that sleep also affects all of the things that you just mentioned as well, meaning that those things are disrupted with disrupted sleep as well, right?
Yes, but when you look at a disruption of a circadian rhythm disorder, is it like the feed forward disruption for the pituitary gland and then the release of the thyroid stimulating hormone? And that's what's causing the subclinical hypothyroidism. So an example, busy brain is a triad of symptoms of chronic stress seen in high achieving professionals. We ran this neuropsychology test that we relayed, the busy brain test, in 17,000 people in a 2-year period. And we found that the triad of symptoms in high achieving professionals we see is 3 things: adult onset attention deficit disorder or challenges in focus, ruminating anxiety, and insomnia. The insomnia patterns were typically difficulty falling asleep and staying asleep.
Right.
And the example for thyroid, it didn't have to do with sleep. It's under chronic stress with the disruption of the hypothalamic pituitary thyroid adrenal axis that 1 in 8 women actually are walking around with undiagnosed subclinical hypothyroid disease or possible autoimmune thyroid disease under chronic stress, and maybe being labeled as by other doctors and clinicians as, oh, you're just a tired mom or you're hormonal. And that 40% of those women, their only symptoms were difficulty focusing and feeling anxious. And so this is a little bit more complex than just sleep deprivation. But to your point, you are right. In addition, sleep deprivation, if you're feeling anxious, could be a part of the problem.
Okay, so if we identified these pathways, and ultimately, the circadian rhythm is a big part of this, how do we treat it?
Yeah, absolutely. So that was it. I wasn't going to write the scientific book and not research the cure and make it in a way that was accessible for today's busy professional that I typically serve. So we tested this protocol and fine-tuned it in over 1,000 executives in corporate America and delivered the programs virtually because it started during the pandemic. So I wanted to preface this that way.
Yeah. And
then the idea was could we heal or at least identify a problem in those 5 key areas that needed healing? Sleep, we'll get to all of this. Hormones and inflammatory markers, which means getting labs checked, is a key part of the protocol.
Yeah. How
to use food to fuel ourselves properly, so that we're not stress eating and we're not putting people on a diet, and we'll get to that. And T is the role of technology. So step 1 of the protocol, we actually asked, Buck, is for people to take the busy brain test and get a brain score. I'm practical. I'm a brain doctor. Most people walk around and say, hey, Buck, Romie, who isn't stressed these days, too much on their schedule and on their plates? And so that's step 1, is to take that busy brain test. It's on our website. We'll put it here in the show notes for free and get a score. And this is, again, validated neuropsychology test. If you score above a 30, it's showing that chronic stress, not acute stress, but chronic or acute episodic stress is now affecting your brain health, your mental health, or your physical health. So above a score of 30 is what we look at. That's step 1. Step 2, to your point earlier in the podcast, we start with sleep. That unless you fix sleep, the rest of, the situation won't be alleviated. We really needed to reset the circadian rhythm. And so we have what we call the 7-day sleep challenge, which is the steps that are based in cognitive behavioral therapy for insomnia. And we identified through research a few supplements that could help so that we're not putting people on prescription benzodiazepines and sedatives for sleep.
Not that we want to go through that would give away the whole thing, but just curious in terms of your sleep supplements, magnesium, I assume.
Magnesium glycinate specifically.
Right.
Magnesium glycinate is the one that we researched most specifically for brain health without causing GI disruption, crosses the blood-brain barrier. So we recommended the magnesium glycinate, and the other one is 5-hydroxytryptophan, 5-HTP, natural precursor of serotonin and then melatonin. In clinical studies, even low dose of 5-HTP has been found really effective in treating insomnia, difficulty falling asleep, also staying asleep, but also helping the circadian rhythm. It's used often in higher doses in anxiety and depression, but we use it in low doses. The clinical caveat here is please work with a doctor, naturopathic, integrative functional medicine doctor, because if someone is on a prescription SSRI drug,
that's right. I was going to just say
serotonin. So that's the only thing. And there's other options in the book that we discuss, but those 2 alone will, 1, help people feel better because now they're sleeping, but 2, reset the circadian rhythm.
Right.
Along with that, there's the CBTI protocol of setting a regular time to sleep or regular time to get up, and other that we give. And if people take the Busy Brain test, we give this as our gift. People get it delivered to their email, the first protocol. And,
interesting.
Here was the interesting thing you'll find. I want to say this is, as doctors and lawyers or whatever, a lot of us studied on our own, and people will read this book and go through it on their own and be like, does it really work? The most effective thing that I found doing what I do as a chief wellness officer and studying organizational wellness is a concept known as cohort-based learning, is that if we want to create behavioral change, we do it together as a community. And it's one of the most powerful things. We've been doing this for years with teams. In chapter 9 of the book, you read in my previous role in Evolution Hospitality, we did a study of digital detox and improving sleep in 500 employees. And this is a company, by the way, that manages hotels that are open 24 hours a day, 7 days a week, 365 days a year. And it's still one of the most popular programs is to help do the sleep and the digital detox with it, and one that we run with other corporate teams and actually changes culture. Because imagine this. Everybody is sleeping now, Buck, and everyone is feeling better. And all of a sudden the CEO or CHRO are like, what are you doing? People are like talking about this brain shift thing going on. Like everyone's happy. The people that are normally in HR complaining, or the teams that were in conflict, are like now calm and getting along. And that's the impact that I think we don't realize, that sleep can, not only you've had other sleep experts talk about individual health, but think about it on employee wellness. And so it's a really popular program that we run with teams around the world.
I'm going to give you a couple of questions, just just curious on your thought. Other nootropics that you're interested in for stress or for brain optimization? I'm curious. You've probably looked into this.
It's one of the most common questions I get. And so when we look at the trend of nootropics, I think from over a decade ago now, initially started a lot in the tech world where people were trying to use nootropics to biohack avoid getting sleep and working longer hours, and to substitute not taking a prescription stimulant like Adderall, Vyvanse, et cetera. And so I am more a purist, having gotten my board certification in integrative medicine. I'm more interested in individual results of things such as St. John worts or ginseng. But I don't want to use any of those blanket, and that's why we don't recommend nootropics without getting somebody's labs and understanding where their AM fasting cortisol level is and where it is at nighttime as well. So I think it's not responsible to just blanket put someone on these nootropic bends and they may be getting a higher dose of ashwagandha than they really need in the daytime and all of that. So I think it's on a case-by-case basis. Is there one that you typically prescribe or like yourself?
I mean, there's a few that I use just in terms of overall brain health. Obviously, some of these, some fish oil, and I use like cocovia, the cocoflavanols, magnesium, specifically as you mentioned. I use Magtine, which is so those are a few. But
so the fish oil is interesting. I don't consider that a nootropic, but you and I are on the same page on that one. I think the root of a lot of brain health problems and other cardiovascular issues is that somewhere 30, 40 years ago, fats became the enemy, and we replaced too many simple carbohydrates, processed carbohydrates, and now we have this diabetes metabolic syndrome crisis. But in week 6 of the protocol, that's actually the protocol, that fats are not the enemy, and we add 1 to 2 servings of fat with every meal. It helps satiety, it helps brain health. Hopefully by now people have gotten their labs and know their vitamin D3 levels. It'll help absorption of vitamin D3, which most people are deficient of. So we definitely, a food source of omega-3 is preferred, but if not, or people actually have checked their levels, then absolutely a good quality low mercury fish-based omega-3 or the fish oil capsules, as you're saying, are preferred. But when it comes to these nootropic blends, there's so many on the market, so many tied to affiliate marketing. I had to write this book based on science, and there isn't one nootropic blend that's out there that's been studied the way some of these individual natural minerals or herbal remedies or medications that I've put in the book, like vitamin D3 or 5-HTP or magnesium chloride, have been studied.
Vitamin D is another big one. I mean, I take that as well. also was curious on, and hopefully you don't mind, I'm going a little bit off track, but I've got a neurologist here, so I'm curious on your take on things. One of the things I've been looking at for me personally, because I do think my sympathetic system is way dominant, and my heart rate variability scores are way too low, and I haven't been sleeping great lately. So one of the things that I thought was very
the brain shift protocol and the busy brain cure book.
That's right. One of the things.
Why don't we pause this interview and take the busy brain test? I got you. You can take your buck. I got you.
I think it's going to be. I'm going to fail it. But one of the things I looked into, was curious about is, and of course I just seeing ads for these transcutaneous vagal nerve stimulators, and which is interesting to me because. Vagal nerve stimulation is, actually implanting a vagal nerve stimulator has been a very useful thing in the space in depression and that kind of thing.
I'm old school. I was part of the original clinical trials for for epilepsy and then for depression. So, I remember that. It's interesting where the trends are coming, to all the, vagal therapy that people will now, it's a trend in a post-pandemic world. They've gone away from the limbic system modulation to this vagal therapy, and people will claim all sorts of devices and things that are out there, are helpful. Which one are you looking at that's piqued your interest?
Though I just ordered this Pulsetto device, and again, I have no idea if it's going to work, but I was just curious what your thoughts on are, because basically it's transcutaneous stimulation. I don't know how they localize, or how they're localizing the vagus nerve or whatever, but I thought, I'll send it back. They give you 21 days to check it out and check it, see if it works or not. But it seems like in theory,
do you wear it and sit and meditate with it, or is it wearing all?
You just wear it for like periods of time. They don't even require that you meditate with it, because again, it's just this sort of electrical stimulation of the vagal nerve, the cervical, in the cervical area. Some of them I think you put in the ear and the tragus and that kind of thing, but this one is in the this one's in the neck. But in theory, it sounds like a really good idea. In theory, it sounds like a very interesting idea.
Here's the thing is, every time I speak, Buck, I give keynote lectures. People line up exactly like you do with questions about supplements or all these devices.
Sure.
I can't keep up with
That's
them.
what everybody
every
needs.
Time I'm on an interview. And here's the thing is, I'm a purist. And one is, I don't know this device, so I can't speak to it, and I love to see the clinical studies. But the second thing is if we want to reset get balance and not be in sympathetic overdrive, thank you for your honesty, which so many, I used to live there. People read the story in my book of going through burnout, having life-saving surgery, coming out the other side. There's a simpler way that may be less sexy than the latest device that we're wearing on our body in wearable tech. I'm not opposed to wearable tech, but here's the thing I want to know is, can we start with the brain shift, which is a micro habit or behavioral change? And so the first thing is, can we start prioritizing our sleep? We've given simple supplements to do that. The second thing is we do digital detox, the T in the brain shift, that we add that. And
digital detox just meaning like staying away from your devices, blue screens at night?
In our clinical studies, we found 30 to 60 minutes before bedtime was most effective, right? Because we live in a pragmatic world where most people are working on digital devices throughout the day. And then in week 4, we wanted to introduce some kind of mindfulness program, but people with a busy brain or sympathetic overdrive have a hard time. Obviously, they would sit down and someone that practices mindfulness say, I can't meditate, I'm doing something wrong. So we train people to do a brain pause, and believe it or not, you could get the same kind of parasympathetic response doing sound healing. So putting in 2 earbuds and listening to binaural beats music as an example is one thing that I can offer, and we found that effective. We also talk about shaking, the shaking in the body as a possible method too. So I want to keep it simple, and that we know that people, if you heal a busy brain, you go through this 8-week protocol and you adapt even one thing and you decide, I'm going to pick up a traditional meditation practice and meditate for just 20 minutes a day. We offer people at bedtime since we're busy during the day, even if it's a guided meditation with music or someone's voice, that alone can start to heal the sympathetic overdrive and start to create a more balanced, parasympathetic response. And that this is the foundation of now thousands of clinical studies that show people who regularly meditate now can heal refractory depression, normalize high blood pressure, have a normalized blood sugar, all of these things of sympathetic overdrive.
Do you have a sense of how long it takes, like, for somebody who starts meditating to get that benefit? Because certainly, I've gone through that. And I meditate, I go through a period and then I give up after like 3 weeks because I don't feel like it's doing anything. That kind of situation. And I know I'm not alone. This is like
asking that honest question. A lot of people are that way. It's kind of that instant gratification. I want to know if I go on a diet for 1 week or 3 weeks, how much weight am I going to lose, or I'm going to give it up?
Yeah.
Meditation, we know typically the clinical studies show, depending on what we're looking at, but let's say structural and functional changes in the brain, we know a minimum of 8 weeks.
Okay.
But what we do find is people that have been meditating even consistently for 14 days start to feel the initial euphoria people may feel after they go to a yoga class, that initial, GABAergic response, and they start feeling better. The problem is they're like, I felt so great when I meditated, and then I had to go out and face my work day and the stress got bad again, right?
Yeah.
And so that's what can be the issue. It's not that meditation isn't working. It's that it's not going to be that instant gratification process of, you went on a cleanse and you dropped, 5 to 7 pounds in belly bloating. Well, that's a temporary fix and not something necessarily permanent or recommended. And so as someone that's been meditating now for well over a decade, I still have days that I sit down and my monkey mind is going. And once you learn to meditate, you realize I'm not going to have judgment of what's happening in my brain during my meditation, nor am I going to have attachment to outcome. So I don't need to see at 3 weeks, my blood pressure should be going down, and at 8 weeks, it should be normalized, Dr. Romie, or meditation didn't work. It's going to be slightly different for everyone. But
it is useful to know, like, I think that for anybody who's giving it a real try, like, again, you may not get outcomes, but if you're going to try this as a meaningful thing, maybe you should try it. Just say, I'm going to do 8 weeks, whether I think it works or not. I'm going to do it every day for 8 weeks, and then I can judge.
And then have something to measure at the beginning and the end. I think that can help people. So we see in clinical studies, people are measuring your depression scale or anxiety scale or a blood pressure, whatever it may be, how well you're sleeping. Like, measure something at the beginning, at the end of the 8 weeks, because I'm a firm believer that if you have something you're measuring and you can see an outcome, you're going to feel better.
Let's go back real quick to, I'm just going to also ask you another random question that I've been thinking about when it comes to diet. So there's all these new, I wouldn't call them new, but there's this sort of this school of thought that's looking at various types of dementia as maybe, okay, you take Alzheimer's disease and we think about tau and beta amyloid plaques and all that. But there's a school of thought that's thinking that these things actually might be downstream of the actual insult in the first place. Specifically, the idea being that maybe they are downstream of neuroinflammation, of course, that you've been talking about. That is the result of two things. One is inadequate blood flow over time, and second, which I think is really interesting, is this notion of insulin sensitivity issues with at the blood-brain barrier.
I can talk about that. Yeah, let me address that because it's actually addressed in my book. So it's not far off topic. Mayo Clinic calls it diabetes type 3 in simplified terms, with this idea of, just for your listeners who may not know, type 1 diabetes we know is, typically onset in childhood and a complete deficiency of insulin. Type 2 diabetes affects the pancreas. You start getting insulin sensitivity, and then, eventually if it goes untreated, you need actual insulin replacement. replacement. But then there's insulin diabetes type 3, which is talking about the insulin receptors in the brain. It's actually something I address in chapter 7 of my book as what happens when we're under chronic stress. That under chronic stress and why we have this adult onset ADD, difficulty focusing, and anxiety is that under chronic stress, when we are disrupting our hypothalamic pituitary adrenal axis, that once there's, elevated cortisol, we will see a drop in a blood sugar level. We will see then, replacement of the blood sugar either through food or, through our regular biological mechanisms internally, and then insulin, release. Now, the more you do this in the brain, it's actually causing this instability that initially is leading to these symptoms in chronic stress of I can't focus, ADHD,
like brain fog,
anxiety, and then as you go on further, can lead to these symptoms of actual cognitive challenges and brain fog and recall and memory. And it's something really important that we know is now a risk factor for Alzheimer's dementia, is this insulin resistance in the brain, or type 3 diabetes. It's very well recognized. It is the foundation of my protocol for nutrition in the book. Because I'm a firm believer, and I really want to address this here, is probably contrary to a lot of the experts, Buck, you've had on your podcast. I don't prescribe any one kind of diet. One that's psychologically and harmful and more stressful to people when they've been given a restrictive protocol. Two, as a chief wellness officer, it doesn't foster diversity, equity, inclusion, belonging. Most of the nutrition plans we see that are touted by the health and wellness experts are very Eurocentric, Western diet specific. And, as a chief wellness officer in a global organization, we want everyone to have a seat at the table and not say your foods that are tied to a religion or ethnic background are bad or wrong. So we had to come up with a system. And the idea was overall, one thing and one thing only is at the root cause of a lot of these diseases in the brain and in the body, and that's high sugar, high glycemic foods, or I don't want to just say sugar, because to people that don't have a medical background, they're going to think it's just the added white sugar in a sweet drink or a food. It's actually any high glycemic carbohydrate that'll spike your blood sugar quickly. So white flour, white potatoes, white rice, white bread, white sugars. So we give a list in the appendix of our book. Our rule was this: if you're going to have one of those foods, do not have caffeine simultaneously for 1 hour before or after. If you're going to consume caffeine, which most people want for, a cognitive focus, attention, energy during the day, then no high glycemic foods. Very interesting factor is that it was actually a stressor on the insulin receptors in the brain to have both a combination of a caffeine load as well as a high glycemic sugar at the same time. And so that was one way, after people have restored sleep, that we get people to stop stress eating and craving sugars. And now they're having caffeine, they're having their healthy fats. So we've re-regulated circadian rhythm, leptin, ghrelin. And so now you don't, bottom line, have this urge every time you have an emotion to finish an entire bag of potato chips or cookies. But hey, listen, if you're having a family meal and it's a child's birthday party this weekend and you want a piece of cake and ice cream, be mindful and schedule that comfort food. Just be mindful of the caffeine. And that alone, we found, was key to helping heal the negative impact of chronic stress and burnout in the brain, and then hopefully lead people down the road to eating less high glycemic foods.
Yeah. And I think, I've always labeled hyperglycemia as probably the biggest killer of, people in general, because it's sort of
insulin
resistance. But one thing I was curious about, and I know you just said you're not into any specific diet, but from the physiology standpoint, when I heard, the insulin receptor issues in the brain, that kind of thing, the first thought I'm thinking to myself is, so does that mean that there may be value in a ketogenic diet? Because the ketone bodies, what was, just for people who are listening, a very, very low carb diet results in the body preferentially, ultimately, simplifying this, it breaks down fat as the alternative fuel. And when fat breaks down, it breaks down into ketone bodies. And these ketone bodies are actually, in some ways preferred by the brain, and they don't require receptors to go in and out through the blood-brain barrier. So the question I have is, what is I'm curious on your thoughts on the ketogenic diet for brain optimization.
Well, the ketogenic diet, again, I love that you're asking a neurologist this, and I have my own bias, but we've studied the ketogenic diet in really early on because of its initial help in refractory pediatric epilepsy and studying it in adult epilepsy. And that's where it came from. And it's a much tougher ratio of eating higher amount compared to protein or carbs for epilepsy patients compared to the public. Here's my thoughts on that, though. As an integrative medicine doctor and someone that has looked at all these nutrition plans, the ketogenic diet is one of the most difficult to sustain.
It is, for sure.
And so what we would find is people were doing more harm because they could stay in a state of ketosis for a few days, a few weeks, and then would, quote, want to have a cheat meal, and this concept of cheat meal. And that damage of introducing now a high glycemic load and coming out of ketosis could be potentially worse.
Yeah.
And two, when you look at the psychology literature of doing these highly restrictive diets like Atkins, like ketogenic diet, et cetera, very strict cleanse where you're gluten-free, soy-free, all these are, is actually it's raising more stress hormones in the brain and creating guilt, shame, and trauma. And those things psychologically are more damaging. We don't, the mind-body connection. And so that's why I don't promote any one type of strict diet. Really what we're seeing coming now in the larger body of work that can help the type 3 diabetes and insulin resistance is actually the intermittent fasting. Has actually been shown to be even more highly beneficial than any of these other paleo versus keto versus whole foods, all of those, ketogenic diet, et cetera. However, I'm not going to blanket recommend that to everyone either. We know when people have a busy brain and they're living in chronic stress and they're waking up with elevated cortisol levels, you shouldn't have them fasting first thing in the morning. So really, my book in the Busy Brain Cure, I'm meeting people where they're chronically stressed and maybe struggling to lose weight and that first, and healing that component of the brain and the body, and then saying, let's work with a specialist with your lifestyle, your food preferences, your spirituality to come up with a nutrition plan that works best for you. So I'm practical and I won't push everyone towards one diet. But if you really wanted to look at the comprehensive medical literature, it's probably the intermittent fasting and various protocols of that. And the second one is, you've read the benefits of the Mediterranean diet as well, again, which is promoting a healthier ratio of healthy fats and whole foods, whole vegetables and meats. So
Then I want to make sure we don't keep you forever here. The book again is The Busy Brain Cure, the 8-week plan to find focus, tame anxiety, and sleep again. How and then the course you mentioned. How do people find out more about that?
So the 8-week plan is in the book. Chapters 10 through 17 walk you through that.
Okay, got it. It's part of the book. It's not like a video thing separate.
No, it's already there. We get hired in corporate America to run this 8-week protocol to help the burnout mental health crisis. And so that's my team of experts and myself that actually run it live with supplemental videos and et cetera. But no, we're not upselling a course. I put it all in the book. I firmly believe in this solution and this healing. It is in the book. We have supplemental materials online as just a part of the book that is there for people to download. But yes, it is all in the book for people.
And is that available, that additional, at drromie.com?
Yes, my website, you can take the Busy Brain test. You can find a link to buy the book. And the book is now being sold globally wherever books are sold in stores, as well as on Amazon, Barnes & Nobles, Target, Walmart, etc.
Fantastic. Thanks so much, Dr. Mushtaq. It has been a pleasure to talk to you. Hopefully it wasn't too annoying with all my random questions.
No, you know what? I think you did a great job, and I think it'll be really. You'll have to keep me posted on that device that you're ordering and how it goes.
Well, I'll try anything that's pretty. That is I kind of think of it as an asymmetric thing where, okay, there's no harm in it that I can think of. putting a vagal nerve transcutaneous stimulator on my neck for a few minutes a day. And I can measure it because I can measure my HRV and I can measure these things. So in real time, if it makes a difference, then great. If not, I'll send it back, right? So.
Okay, and then come to me. There's other ones for HRV too, like heart math and all these things.
What are those? What are those? Curious, because I mean, this is. What do you mean heart map? What is that? What is heart map?
Heart Math, the Heart Math Institute.
Oh.
They actually are the leading folks. Sorry, we were supposed to be wrapping up this interview.
Oh no, I'm curious about this now. This is good.
Yeah. So the initial, a lot of the initial data in the mind-body connection was done by the Heart Math Institute. You can look them up. A lot of the founding studies of looking at heart rate variability as changes under stress and other disease states and its risks to, cardiovascular disease, cancer, et cetera. They've been doing this for decades. They actually have their own device
They do. Okay.
that actually trains people without being attached to your
stimulator. Okay.
To stimulate that, but they're actually measuring your heart beat variability while they're teaching you specific breathing techniques that are helping to modulate your vagus nerve and through breathing techniques and control breathing. And it's been actually shown to be very effective. That feels a little less invasive to me and a good baby step to meditating regularly every day, Buck, which I'll check on you. And my intention is we're going to get you meditating every day for 20
Well, I am doing that too. So anyway, love to have you on again. Thanks. Appreciate it.
Thank you. Thank you so much, Buck. I appreciate it.
Thanks for listening to Sapio with Buck Joffrey. A quick reminder that while I am, in fact, a surgeon, nothing I say should be construed as medical advice. Now, make sure to include your physician in any medical decisions you make. And also, if you're enjoying the show, please make sure to show your support with a like, share, or subscribe. Until next time, this is Buck Joffrey for Sapio with Buck Joffrey.